Hello, I'm William A. Van Horn, MD, a geriatric neuropsychiatrist who specializes in Alzheimer's disease. Today I'm going to talk to you about what I like to call the Alzheimer's miracle. Now, honestly, it wasn't a miracle, but it was really fascinating. And I've seen thousands of people with Alzheimer's. I have never seen this happen, but it was really, really cool. Her name was Louise. She was 89 years old, African-American woman. That's significant because she grew up in the South, and she was during the time of severe racism, because she used to, when she came in the hospital, she'd sit in her chair, she'd put her head down like this and wouldn't open her eyes. But she would yell out, "They're killing my sons. Don't you hear them outside? They're killing my sons. Please help me, please save me." That's what brought her there, because she wasn't opening her eyes at the nursing home and she was screaming all the time. And I was the medical director of a unit that takes care of advanced dementia patients who are having behavioral problems. So there's Louise sitting there, and I got her on certain medications. Basically with Alzheimer's, what's going on is it's like a boat where the bottom is starting to decay and there's getting holes in the bottom of the boat. And so the boat is sinking, which means the brain is dying, the neural networks in the brain are decaying. And the treatment is to plug those holes. Most people in my field don't know how to plug all the holes. I'm very aggressive with very safe medications to try to plug every hole in the boat, or in other words, try to energize every part of the brain that I can energize to try to bring it back as much as possible. Now, my expectations with Louise weren't real high. Clearly, she had advanced dementia. That means she couldn't even tell me her name. She certainly didn't know the date. She didn't know what state she was in. And she wouldn't even open her eyes. So I put her on 3 or 4 different medicines. My standard protocol started work. It takes time. You have to start with low doses, work your way up to higher doses. So I did that over about 2 weeks. 2 weeks later, she no longer was hallucinating. She wasn't hearing those people killing her sons, but she still was sitting there slumped over. We had to feed her ourselves. She wouldn't eat on her own. And she really, other than the auditory loss of psychosis, she really wasn't much better. So I sat down at treatment team. This is our team of professionals who work together to help these patients, the nurses, the social workers, the clinicians, and so on. And I said, if I don't fix Louise, this is it for her. This is the end of her life. See, what I do when I work with somebody, when I work with dementia, I know that when they walk out of there, if they're still hitting people and they're still screaming, which happens to up to 80% of patients with advanced dementia, that they lose this part of their brain, the front of their brain, the frontal lobes, and when they start losing that, they lose control of their behavior and they become violent. So if I don't fix them, and there's very few people that do this kind of work in my field, if I don't fix them, their life's over, because what will happen is they'll go back on end of life care and they'll just sedate them until they die. So I don't give up unless I run out of choices. So I did have a choice left, and that was a medicine called Prestige. It's a very good antidepressant, very energized, one of the best out there. And I said to my treatment team, I said, I'm going to try this with her, and I'm going to try it at very high doses. And this is an important part of the story, because Prestige was approved by the FDA for 50 milligrams and 100 milligrams a day, but it was tested at 50, 100, 200, 400, and 600. I saw the studies. And the studies showed that it was safe all the way up to 600. Now, the general idea with old people is you give them less medicine, not more. What I have found with Alzheimer's patients is because their brain is so decayed and their neural networks are so broken down, sometimes they need more than a 40-year-old who's suffering with depression. Now, the term is antidepressants. I prefer the term brain energy medicine. Prestige is a brain energy medicine, and it raises a chemical called serotonin, and it raises a chemical called norepinephrine. So I started this medicine, and I'll get to the end of the story because the end of the story is really good. I put her on it. Over 3 weeks, I went from 50 milligrams a day to 400 milligrams a day. Now, if an average doctor walked in and saw an 89-year-old on 400 milligrams of Prestige, they'd say, this doctor is crazy. Well, let me tell you what this crazy doctor accomplished. She was transferred from our advanced dementia side of our hospital to our high-functioning side for geriatric patients who are just suffering depression, who don't have cognitive problems. Because she was so violent, no one wanted to take her to assisted living, so she lived on that unit for 3 months. She was playing cards, she was doing puzzles, she could do crossword puzzles and all kinds of things. She wasn't even very demented. Louise woke up, it was like an awakening, and functioned very well for the next 3 months till we transferred to assisted living. So that is what I call an Alzheimer's miracle, when in fact she probably only had early Alzheimer's. Thank you for your time.